lots of things that we can talk to patients about. There are lots of risk factors that we can address. There are lots of subjects that might be applicable to them. At the end of the day, the clinician is the one making the decision-making for that patient. The clinician is going to give the recommendation based on everything they know clinically, and everything that they know about the patient. So while it would be great to say every patient that has a low macular pigment needs to rebuild it, that's only one part of the decision-making process. A young, healthy patient that doesn't have any other risk factors, you may say, do you know what, we think that by changing your diet slightly, you're going to give yourself some benefit, we're going to keep an eye on what you're doing. For an older patient that has some risk factors, that's when that decision-making process becomes a little more complex. And especially for a cataract patient that's trying to preserve that outcome for the long term, if they have other risk factors that might increase the risk of retinal disease down the line, then the macular pigment becomes a more relevant and more specific biomarker and risk factor to address. So patients, for instance, that have a family history, maybe they have some early changes in the macula, some drusen, for instance. If their macular pigment is also low, that then becomes a very good addressable risk factor that we can talk to them about. We don't necessarily want to prescribe or recommend rebuilding macular pigment for every patient. It really depends on the risk factors that that patient has and how we can address them. So an older patient that has some risk factors, some changes to the macula maybe, family history, if they also have a depleted macular pigment, we can educate them about the importance of rebuilding and maintaining that, and it gives the optometrist an opportunity to have that conversation about that specific intervention that's available.